Good evening, friends. I'm thankful to Dr. Niranjan Agarwal, the president of the Mumbai Surgical Society, and Dr. Yadav, and all the executives share my views how to evaluate a neck swelling. I think neck is the most complex organ of the body, maybe after the brain. Almost about 85 types of swellings can arise in the neck. It extends from one bone to the other, mandible to the clavicle. We always divide the neck anterior and the posterior triangle, but we forget about there's a big part on the posterior side also, what is called the nape of the neck. And then sternocleidomastoid forms a big chunk in the neck, and that we forget that what will happen to the swelling in that area. Most of the time, we include those swellings in the anterior triangle. What is a neck mass? Neck mass is defined as an abnormal lesion, is congenital or acquired, which is visible, palpable, or seen on an imaging study. And a guideline development group have shown that swelling arising from the mandible to the clavicle, deep to the skin, is a neck swelling, which can be of the various etiology. And one should consider a swelling malignant if it occurs in the adult and it is more than 2 weeks duration. The complex anatomy of the neck, which has got all types of muscles, the nerves, the vessels, the lymph nodes, and there are almost about 200 to 800 nodes are there, the salivary glands, trachea, larynx, esophagus, thyroid, parathyroid, thymus. Various potential spaces are there apart from the skin, fat, fascia, muscles, nerves, vessels, etc. and etc. So what are the various types of neck swelling? As per location, as per etiology, and as per duration. As per location, where they are situated, as per etiology, what type of the etiology is there, and as per duration, there is a rule of 7 which is there. The swelling is for 7 days, it is inflammatory swelling. For 7 months, it is neoplastic swelling. 7 years is continuous. So according to the tissue origin, it may be mainly from the lymphatics, age of the patient, whether it is a congenital one or it's a malignant one. And as per the number of the swellings, if there are multiple swellings are there, that suggests that it is from lymph swellings. So they can be inflammatory, the congenital, the traumatic, and the neoplastic variety. And these are the various masses which can arise, like inflammatory, the lymphadenopathy, the tuberculosis, the swalloidinitis, and inflammation of the congenital cyst. The congenital variety, the sebaceous cyst, the thyroglossal lymphangioma, the heart cyst, laryngoceal, pharyngeal diverticulum, iambic cyst, branchial cyst, ranula, are the congenital one. And then metaplastic can be the primary or it can be the secondary. Majority of the time, they are the secondary one from the head and neck malignancies. It can be the thyroid, it can be lymphoma, and the benign tumors are the carotid body tumor there, the vagus may be there, or the salivary gland tumor there present as mass neck. And then various deep-seated infections which are there, like the Rodriguez line, periton strepsis, the parapharyngeal abscess, the retrograde abscess. And the various traumatic type of the neck masses, like at birth, there is a trauma to the sternocleidomastoid, which can lead to sternocleidomastoid tumor. It can be because of trauma. There may be the pseudoaneurysm of the major vessels, or sometimes, like after the surgery, there can be neuromas of the nerve endings here for the swelling in the neck. So, basically, if we look at the location-wise, if we start from the submental, it starts on the submental lymph, the dermoid, the Ludwig's, the Ranula, and Subhyoid Bursitis. There can be Thyroglossal Cyst, there can be aberrant thyroid, Elfin nodes may be there, thyroidismus tumor, the advanced laryngeal, suprasternal dermoid may be there in the space of burn, or the lymph enlargement, and sometimes thymic swelling may come in the suprasternal space. There can be various aneurysms and the cold abscess. So if we look at the suprasternal space of burn, there can be lipoma, there can be sequestration dermoid, the gamma, the thymic swelling, aneurysms of various big arteries, and the cold. And then in the lateral swelling, depending on what place it is, whether it's a carotid triangle or whether it is the submandibular triangle, there may be different types of swellings. And if you look at the submandibular triangle, which is bounded by the lower border of the mandible, anterior digastric and the posterior digastric is there. There can be lymph node, salivary gland, plunging ranula, Ludwig angina, lateral submandibular, and in the carotid triangle, which is bounded with the sternocleidomastoid, the digastric, and the omohyoid, there can be branchial cyst, lymph node mass, the aneurysm from the carotid or the carotid tumor, thyroid swelling, the laryngoceal pharyngeal pouch, lymphangioma, sternocleidomastoid tumor, and neurofibroma. That may be there. And in the posterior triangle here, which is bounded with the sternocleidomastoid, the trapezius, and the clavicle, there can be the solid swelling like metastasis there or tuberculosis, lymphoma, lipoma, cervical rib, pancreas tumor, polycystic swelling like the lymphangioma, hemangioma, cold abscess, or there can be pulsatile swelling like subclavian artery aneurysm, vertebral artery aneurysm may be present. And then there can be swelling in the nape of the neck, which is from one side of the trapezius to the other side. There can be diffuse lipoma, carbuncle may be there, skin infection, the lymph, and then encephalocele may come in that area. So according to the age group, if we look, and the pediatrics is mainly the inflammatory one which is there, while in the young adults, more congenital starts coming here, and in the elderly, it's mainly the neoplastic type. So what you have to do is the quadruple assessment for the neck swelling. Take a good clinical history and do examination, do various imaging studies. You carry out the confirmation by cytology or histology. And in some cases where you are suspecting the malignancies, is endoscopy carry out. So what are the various steps of evaluation? Take a very good history, do a very careful head and neck examination, ENT examination, and then ultrasound should be done as the first investigations, which will tell you about the type of the swelling it is. And then you can go for the FNA-C or FNA-P for that. And then sometimes the chest X-ray, though it is not routinely done, or CT or the MRI is done. Sometimes the PET scan is done and followed with the pan endoscopy. And you can do the excisional biopsy, or you can do the frozen section and neck dissection for the diagnosis. And certain ancillary tests can be carried out. So you have to examine these patients in the sitting posture, ask the patient to swallow, ask him to put the tongue, look from the back also by flexing the chin and turning the neck to the affected side. You see for that the patient has got any lump, and in fact, but you better ask the patient that where is the lump, and you definitely examine that area very carefully. Examine bilateral neck, examine all the lymph nodes which are there, and in suspected malignancy, you have to examine the oral cavity and the posterior part of the tongue, the pharynx, etc. Just for telling the students here, for knowing that what are the things you have to do, the examination for any lump in the body, the 5 students, 3 teachers go for campfire, site size, shape, surface, skin, and the scar, tenderness, transformation, and the temperature, and you see for consistency, attachment, mobility, pulsation, fluctuation, irreducibility, regional lymph nodes, and edge of the swelling. So plain X-ray, usually it is not carried out, but it can tell you a lot of information, like if the patient has got cervical rib is there, and especially if you're not done the CT scan, then in the thyroid surgery, you want to see that what is the situation of trachea, whether that is deviated or compressed. And then you can find a classification of other organs. The caries spine can be seen, and the laryngoscopy can be seen as a black. Ultrasound is the first investigation it has to be carried out, especially for the pediatric neck mass and the thyroid masses. It differentiates the cystic from solid. And it is important to have the vascular because before you go for the FNAC or FNAB, you must know that whether it is vascular mass. And the CT neck is in fact the workhorse for imaging modality in the adult neck masses. It provides the three-dimensional relationship and it is very good for the bones. So if you really want to see the involvement of the bone is there or it is arising from the bone, one must carry this. And MRI is mainly for the soft tissues and that too mainly for the salivary glands and the tongue. And you want to see the involvement of the nerves and you want to see whether the patient is requiring the radioiodine treatment or the diagnosis. It is better to go for MRI than the CT scan. And a radionuclide scan is good for the thyroid and the parathyroids, and you want to see these two organs. And positron emission is mainly for staging of the head and neck malignancy. And you want to see if there is an unknown primary is there, you're searching for that. And especially for the follow-up to differentiate between a scar and a patient active disease. And angiography definitely for the vascular lesion, any type of vascular lesion, whether it is vascular anomaly is there, or for the arteries itself, the aneurysm dilatation arteries which are there, or especially when you are planning for the embolization, angiography carried out. And then finally, the special cytology. It's safe, rapid, inexpensive, avoids the open biopsy, and has got a minimal complication. You must be sure that it is not a vascular problem before that you put the needle at particular lesion. And then the triple endoscopy has to be carried out, the laryngoscopy, the bronchoscopy, to see for, especially for the unknown primary. There are secondaries, the neck are there. You're searching for that, you carry out. And then you can do the pan endoscopy where you also include the nasopharynx, where the primary may come in from the nasopharynx. And then there are a few common ancillary tests which can be done, like especially for the thyroid. You have to do the thyroid studies. You have to look for the parathormone, the serum calcium, etc., for the various neck swellings. And then the examination under anesthesia is important, especially for those deep-seated lesions which are not accessible. You carry it out. You do the scopies at the same time and you take the biopsy to confirm the diagnosis. Now coming to the individual swelling very briefly, like branchial cyst, age is 15 to 25 years, location in the upper anterior triangle, soft cystic. And if you do the FNAC, it is find the cholesterol in that, it is almost diagnostic of the branchial cyst. Thyroglossal cyst is in the midline, sometimes in the slightly on the left side. Usually it is 15 to 30 years. It moves with protrusion of the tongue, very important. And one should do the thyroid scan before excising this thyroglossal cyst, because that may be the only surviving thyroid tissue. The ranula is on the floor of the mouth from the sublingual salivary gland. Sometimes it can be plunging, presenting as a neck in the throat, and it's brilliantly transparent, making a diagnosis. A carotid body tumor, again in the anterior triangle, occurs in 40 to 60 years. It's a painless, slow-growing, pulsating lump. It may not be pulsatile, and solid, hard, and it moves up and down, but not, it doesn't move up and down, and it moves only the transverse direction, and that is very important for the carotid body tumor. Cystic hygroma, again, there's a big lymphatic sac which may be there containing the colorless lymph. Congenital, it's present at birth or even it may come later on. It may occupy a large space very close to the skin and it contains a clear fluid. And again, the transmission is positive for this type of swelling. And then the hemangioma, the vascular malformation of the various varieties, the capillary, the venous arterial, is purple, and it's much common in the children, and it's a compressive, especially with the venous tie. A parotid swelling can be called a parotitis or suppurative parotitis, or autoimmune parotitis may be there, or there can be parotid tumor may be there, which may be the benign tumors or the malignant tumor. Sometimes you can get huge lumps of the parotid. Now, this man had a lump for 25 years, weighing 8.5 kgs. And you have to definitely carry out the facial nerve involvement, and you check for all branches of facial nerve. And because surgery of the parotid is the surgery for the facial nerve, so you have to identify all the nerves, and all the branches has to be identified for the surgery in the parotid gland. And then there can be thyroid gland swelling, which can be of so many varieties, so many types of goiter. It may be simple goiter, toxic goiter, inflammatory swellings may be there, and the neoplastic may be benign or they can be malignant, right? And the parathyroid, which is classically for the bone stones and the fatty cord bone, you carry out all those investigations which are required, and there is surgery for that. Like this patient has got the left lower parathyroid edema. In the pharyngeal pouch is a defect in the pharynx, which is there where it bulges out, and halitosis and regurgitation of the food is characteristic for making a diagnosis of the pharyngeal pouch. And now this pharyngeal pouch, though it was treated surgically, but now it can be treated with endoscopy also, third space endoscopy for treatment of that. And sternocleidomastoid tumor, usually at the time of the birth, because the injury which is there is a swelling in the middle part of the sternocleidomastoid, and the patient develops the torticollis, that is diagnosed with tumor. A cervical rib, extension of the C7 transverse process, more in females, maybe bilateral. Usually, if it is the bony is there, it's felt at the lump in the hard lump, posterior triangle with a thrill and view over that, and there can be vascular and then laryngocele is the herniation of larynx and cup and pulses pulse. Usually, you find it in the subhyoid position, and it moves to deglutition. That may make differential diagnosis for other swellings with deglutition. Protuberous angina is a infection which is there in the submandibular region. It may be because of dental extraction or salloidinitis or injury or fracture may be there, presenting as a tense tender, and it definitely requires the surgery. A sublingual dermoid cyst may be there, where it may be in the floor of the mouth. It has to differentiate it, the ranula, but the ranula is transmitted via thyroglossal. The sublingual dermoid is not transmitted. Another differential diagnosis of and then subhyoid bursitis, classically below the hyoid bone, differential diagnosis, thyroglossal cyst. Thyroglossal cyst more placed vertically, while this is more placed transversely, and by that you can differentiate a subhyoid bursitis and the thyroglossal cyst. A submandibular gland may be there because of calculus, chronic cyanoiditis, cancer, and chronic disease like autoimmune disease. And aneurysm of the common carotid artery may be there because of congenital traumatic or because of atherosclerosis, elderly patient presenting with a pulsatile swelling, the blue and pill is diagnosed for that. And then there can be schwannoma of the vagus may be there. It's a vertically placed oval swelling at the carotid triangle. It is formed too hard, and if you press it, sometimes the patient has got the cuff, and the patient may have the bradycardia, and that can be diagnostic of the tumor. And Pancoast tumor is also called a superior surface tumor arising from the apex of the lung. Elderly male in the smokers presenting the cough, dyspnea, chest pain. It may involve the C8T1 brachial plexus, causing the problem in the ulnar nerve distribution. There are hard fixed irregular mass triangle, and there may be Horner syndrome. So there are various lymph nodes which are there. You have to examine all the lymph nodes from level 1 to 6 has to be examined. 7 is in the upper mediastinum, so you may not be able to feel that, but otherwise they are all examined, and which can be resort to them other reactions, especially in the upper part of the neck, and then it can be tubercular or the second in the neck or a primary tumor, and infective maybe like the viral infection bacterial infection. And even the COVID can cause cervical lymphadenopathy and COVID-related neck problems which are there. The patient may have the neck pain, the neck stiffness may be there, the parotitis may be there, lymphadenitis may be there, especially the mediastinal lymphadenitis, and rash. So just to elicit what are the specific signs of the various neck swelling, all will depend on the age and location, the duration of the tumor, and then thyroglossal cyst moves to the tongue, thyroid moves to decoration. Ranula is transparent, carotid body tumor, there is restricted mobility up down. Neurofibroma may initiate a cough and bradycardia. Lymph nodes usually are multiple, and parotid elevation of ear. So there is a concept of one-stop neck clinic, and like in King's College, London, started in 2012, where they have got all the consultants, like the maxillofacial consultant will be there, there'll be the hematologist, cytopathologist, and the radiologist, and the clinical nurse here. And they can give the diagnosis of a neck mass, just like the breast clinic. You want that everything should be decided on the same day. The same thing can be for the neck mass. And another important thing which is there, apart from all the treatments which are there, the sclerotherapy has come out to be a big one in the cystic neck. So whether it is a ranula or a thyroglossal cyst or a Branchial cyst there, one can use the sclerotherapy for the treatment of these patients rather than going for surgery of these cystic lesions. Friends, to finally conclude, the diagnosis of the neck swelling depends on age, location, and duration of the arm. And in adults, any swelling more than 2 weeks duration should be taken as malignant unless proved otherwise. Thank you very much.